Yet again, folks, thanks for your patience there. It had all been prepared to perfection with Vicky before we started, but I don't know what has happened now in cyberspace. Anyway, back to our nutritional support in integrated management. You know my background now, but it's important for you to know that I have no financial interest in any nutritional supplement companies, so that my work is always very independent. Important to know that there is a cautionary note in lectures such as nutritional subjects. People must be advised always by their individual healthcare teams. What you just hear in a public lecture is not personalized to you, it's for your awareness. So that is very, very important, and therefore I cannot take responsibility for the outcome of any nutritional applications. Now I have a very, very special message from our clinic director, Dr. Jeffrey Leader, who's very inspiring and has always felt for many years that there should be an integrated approach to Parkinson's, and we have, as his team, have always followed in this way, and which we are very delighted to know that Parkinson's care and support are themselves looking to present for their members together with Kent University, a multidisciplinary support. Now, each person, says Dr. Jeffrey Leader, with Parkinson's deserves to function as well as he or she is able. There are many aspects of functional health, including physical, mental, emotional, and biochemical, which may be affected, and if neglected, may in turn affect symptoms. These can well respond to multidisciplinary support and increase the well-being of both people with Parkinson's and their family or caregivers. Now, this evening, my lecture is based exclusively on biochemically based information, and the scientific references, very comprehensive ones, more than are in the lecture tonight, are to be found in one of our books, which is called Parkinson's Disease, Reducing Symptoms with Nutrition and Drugs. This is just the cover of the book, Parkinson's Disease, Reducing Symptoms with Nutrition and Drugs. Right, now, the presentation, however, tonight will have some references, and a selection of these references are presented this evening and will be found at the end of the presentation of all the slides. But they are well referenced, you will see. Now, what is important to know is that tonight, this is an awareness-only event. It reveals just a peep at some of the aspects of nutritional management which are supportive of functional health in Parkinson's disease. It is always adjuvant to any prescribed pharmaceutical management and other health-related modalities. This is very important to recognize. Now, to the nitty-gritty. Why is nutrition of importance to people? To know this, we need to ask, what are people actually made of? Well, the recipe for making a person, here it is. If a person were to be analyzed in a medical laboratory, the result would be a pot of salty soup. What is in our soup? Protein from fish, eggs, chicken, soy, carbohydrates from fruit and vegetables, fats from meat, nuts, seeds, herring, mackerel, vitamins from fruit and vegetables, minerals, which we get from dark green leafy vegetables and seafood, water, which we get from nature, and oxygen, which we get from breathing. Now, what is also in our soup? We continue. In the body are enzymes. These are magicians which transform substances from one form into another. You can understand they're going to transform what they get from food into various products, enzymes. And these magicians, these enzymes, have to be activated, and they are activated by what we call coenzymes. And coenzymes are specific vitamins and minerals, specific ones to specific enzymes. Now, nutrition is really known as applied biochemistry because our cells work to produce all the functions of our body, not only just dopamine and its related metabolic pathways. This function of this working of the cells is known as the biochemistry of the body. Therefore, you will understand that nutritional support is actually applied biochemistry. Now, dopamine, which we know is connected as a deficiency in Parkinson's disease. From what and where is it made? It is the chemical messenger that controls movement and response to stress. It is made in the brain from protein in the diet. And we all know there is a deficiency of this chemical in the brains of people with Parkinson's. How does the brain achieve this manifestation from protein, which could be an egg, piece of chicken? How does it transform?
Lucille,
yes.
Sorry to interrupt. Can you just click on the slide as you go on to the next slide? It's not showing. Sorry, I can see your presentations there, but the slides aren't changing. Sorry.
Go back. Because for me, they are changing. I'm reading from them. Are you not seeing the magician with the rabbit in the hat?
No, we're just seeing the.
Ask other people. See.
Let me go back again. Let me go to the previous one. Are you seeing dopamine is the chemical messenger?
Sarah, no. I'm looking at Sarah Fro. No.
Oh, why don't you take over?
Oh, what a terrible thing this is.
No, don't worry.
In a very well prepared between you and I presentation.
Shall I get the presentation up myself?
Yeah, do that. Please do that. Please do that.
I'm going to do that now.
Yeah, it's changing.
Right.
What slide are we on?
Okay, so what slide? Tell me what number slide you were on.
I don't know where you got to.
Oh, okay.
What slide is she on?
What slide are you on now?
Now we can only just see a little bit of yours, not a full slide.
1 second.
Wait, let's go from the beginning. Hold on.
No.
Yeah.
That's it.
What slide are you?
All right, it's from the beginning. Let me go forward. Hands up. I can see you there, Vicky. Where did we get to? What are people made of? Did you see that slide?
No.
Yes or not?
No, we heard you present about it. We heard you speak it, just not see it. But that's okay. If you just take us to the last slide,
I want to just you to actually see. Okay. All right, let's start. What are people made of? Can you see that one? A pot of soup?
Hello.
Yes, we're on a poll.
Hi.
Just 2 seconds.
Have you seen?
Go back to this one.
Okay. Have you got the
so
book?
I'm on slide number 11.
We'll go back to 6.
Go back to 6.
Okay, no problem. Okay, we're on slide number 6. Can I just ask people to wave if they can see the screen?
Can they see number 6?
How do I get the view?
No, he can see it.
Yeah, brilliant. Okay, you can all see it. Fantastic. So we'll start from number 6. I'm going to mute myself. And you just say change and I'll go on to the next screen.
You'll have to change.
Okay.
Or I'll have
You
to
need
say,
change.
so now I'm going to have to say change to you. Is that it?
So when you
Because
finish,
you've now got the slides, yeah?
I've got the slides. So when you get to the end of the slide and you want the next one, just say change to me and I'll change it for you.
Vicky, we can't see the slides. We can still see Lucille's version, but we can't see the right one.
Oh, Johnny?
You need to go to the options at the top, the view options, and you can choose which screen you want to see.
Yep.
Johnny? Sorry, they can't. Sorry, could you repeat that?
Everyone else can.
Yeah, there's a tab at the top that says view options, and you can either view Lucille's screen or the Parkinson's screen. So if you click on the Parkinson's one,
We
then you'll see the slides.
must click on the Parkinson's one because something has happened cyberspace-wise between us.
We can see it from our end.
You can.
Yes,
You can see page 7 with a book saying Parkinson's disease.
absolutely. Yeah.
Fantastic. Okay, Lucille, they can all see it.
All right, so
No,
I'll go
no,
to
they can't. No, they can't.
No, one can't see.
I'm on slide 15 with a frozen screen.
Okay.
I had to change in view options and to Parkinson's, and then I could see it.
View
Covered
option.
at the top of
Yeah.
the screen.
You click
Oh.
the view option on your right-hand side.
Yeah.
Mine's at the top of the screen.
All righty, right. See what you mean. To go to what?
View options.
Yeah.
And then shared
Then
screen.
click on Parkinson's. It's got shared screen for Lucille, and it's got then Parkinson's care and support.
Yeah. So which one?
Got
So
Parkinson's
Parkinson.
care and support.
okay. Yeah. Okay. Thanks. Done it. Okay. I'm on number 9 now.
Okay, right. We're all happy?
I can't
Okay.
see the screen. I cannot see anything.
Nor can I.
Okay, just bear with us for 1 minute. I've got my technical expert with us. Just 2 seconds and we will get this all sorted, okay? Just 2 seconds.
You want me coffee?
Such a thing.
2 seconds.
Do these two because I'm doing these ones that
Yeah.
are doubled into separate spaces.
Okay, what can people see?
Okay, so I'm going to choose one person now. Can I just see all the participants? All the participants there?
No, because you're seeing your screen.
Right. So I am going to ask,
Just say wave if you can see
okay,
the
can you
screen.
wave if you can see generating awareness screen number 9? Fantastic. We're good to go. I'm going to mute myself. Screen number 9. Lucille, would you like screen number 9 or a previous one?
This is fine.
Oh, it's all right. We'll
Screen number 9.
go back to it.
Okay.
Go back to it. Yeah. Just-
Okay, I'm going to
yeah.
mute myself now. Off we go.
Can I change the screen or you have to change the screen? That's how.
I'll have to change the screen. So if you just say change at the end of each screen, I will go on to the next one for you.
Change on next slide.
All right. Okay.
Sorry, please.
Right. So what we need to know this evening is, I'll just go back in case nobody could see it. I'll just speak first, is that tonight is, it's very important to understand that you must be always advised by your own healthcare professional, that this is a public educational presentation, and I cannot take responsibility for your interpretation of anything, because nutritional guidance is personalized to each person's individual biochemical status. So this is a peep at just some of the subjects which are available. Next slide. Oh, by the way, before we go on to it though, nutritional therapy is adjuvant, works alongside any prescribed pharmaceutical management and other health-related modalities. It doesn't take over by itself at all. It's part of an integrated way of manipulating the cells in the body to make them function as best as they are able, as the message from Dr. Jeffrey Leader said. So why is nutrition of importance to people? To know this, we need to ask, what are people made of? Next slide. The recipe for making a person, if we were to be analyzed in a laboratory, the result would be a pot of salty soup. Next. Now, what is in the soup? protein from fish and eggs, chicken, soy, carbohydrate from fruit and vegetables, fats, meat, nuts, seeds, herring, mackerel, vitamins from fruit and vegetables, minerals from dark green leafy vegetables and seafood, water, which oxygen from our breathing. Next. Now, also in our soup, in our body, are magicians, which I call them magicians, but they are enzymes. They are proteinists and they transform substances from one form into another. However, they have to be activated, and they are activated by specific vitamins and minerals. And then they are able to change one substance into another according to the needs of the body. So for instance, protein will be changed into dopamine, or carbohydrate into fuel for the cells. This is brought about, facilitated by enzymes, these wonderful magicians in the body, but they are activated by specific nutrients. So if we have a deficiency in some of them, these processes don't happen as efficiently. Next. Right, so the working of our cells is known as biochemistry. And because nutrition is the foundation for with which our cells work, nutritional therapy, or the practice of nutrition as a management modality, is known as applied biochemistry. Next. So dopamine, what is it? We know that it's deficient in Parkinson's. What is it and where is it made? It is actually a chemical messenger, formerly known as a neurotransmitter, that controls movement as well as our response to stress. It is made in the brain from protein in the diet. Next. How does protein, which we eat, transform into dopamine? The answer really is nutritional magic. But of course, magicians all work at a technique. So there we go. Now, I've explained that we have the facilitators known as enzymes. They are the magicians who will change the protein to dopamine, being facilitated from step to step by coenzyme specific nutrients. And you can guess that we nutritional therapists do have laboratory testing to see whether these enzymes and their coenzymes are as in good order as possible, but it is a problem in Parkinson's. Continue, next one. Right, so the essential aspects, so the metabolic steps, the steps which the body takes. Can we go back, please, one? Yeah, no, forward again, please. Next, next. Yes, stay here, please, Vicky. The metabolic steps which dietary protein take to form dopamine. We put maybe the egg or the piece of, chicken in our mouth, the protein. It then enters the stomach. In the stomach, an enzyme meets it. It's activated by a coenzyme called zinc and helps to digest, beginning the digestion of that protein. That initiated protein digestion goes down into the small bowel, the duodenum, from the stomach, okay? And then where it's further digested, and then it moves out of the small bowel into the blood circulation, where another enzyme turns it into L-DOPA, which many of you know is available in pharmaceutical products. Now, the enzyme that is activated to turn this protein further into L-DOPA is the coenzymes are iron and biopterin, which comes from folate. Here again, we've got coming from food. So how important is that? And then the L-DOPA swims up or circulates up to the brain, enters it through the blood-brain barrier. where a specific enzyme is activated by vitamin B6 to produce dopamine. So it is very much an enzymatic and coenzymatic pathway which has to be working optimally, which does not in Parkinson's, but you can see it's nutritionally related. Next, please. Okay, now, so what is necessary always for testing is one having sufficient protein that is able to be digested? All that has to be checked. Zinc, iron, biopterin from folate, and vitamin B6. Those levels are very important to be checked. Next. Okay, now you can imagine that our cells need adequate energy for their specialized functions. And this is a Parkinson problem. Next. Glucose from the diet is the basic fuel used for energy production. Next. Glucose is normally used up after 4 hours. So the body is so brilliant after 4 hours. If you haven't eaten anything, which it can turn into this fuel, the cells will release some protein and fat stores and turn them into glucose by a process known as gluconeogenesis. This is interesting because the brain cannot exist for longer than in health for longer than 5 minutes after there is no more fuel for it. Therefore, the body keeps it going by releasing stores to make glucose. Next. Right, so some of the ingredients for cells to produce their energy supplies that the cells use, just some of them are glucose from fruit and vegetables, vitamins, specific ones, not all, minerals, again, specific, although, again, this is very important to know in Parkinson's that there are some minerals which cannot be used. Therefore, going into a shop and buying the multivitamins can be a dangerous, activity, because you can't just take the iron or you can't just take calcium. Those are ones that are aberrantly used in Parkinson and need very, very careful medical titration or that one, it shouldn't happen at all. So just be careful. So there's specific minerals. Fatty acids, very special kinds of fats are used, which again, the diet will provide. Protein, specific types of protein, and oxygen from breathing and exercise. If we do not have sufficient oxygen from good way of breathing, or exercise is compromised, then the cells called the mitochondria, which are the energy producing cells in the body, cannot multiply, and there is a difficulty for energy production. This is a Parkinson consideration, and certain of the drugs do have an effect on that, and that's therefore nutritional support together with it is very, very important. In fact, I just presented an international medical paper on the subject of the cell energy in Parkinson's. Next slide, please. Okay, however, there is regretfully often a difficulty of the absorption of glucose as the fuel into cells in Parkinson's. But fortunately, it has been found that medium chain triglycerides, which we find in coconut oil, can act as an alternative fuel source and do not require the same specialized metabolism in order to enter cells. And again, one needs advice on how to use this and if it's appropriate. Next, please. As I'm saying, please go back one. Vicky, yeah. There must be professional advice as regards especially diabetics and cancer patients. Sorry, I see I've just put C there, and cancer patients, they need specific personalized guidance. So we have mentioned that, and there must be, of course, attention to exercise and breathing. And if exercise isn't possible, what your movement therapist will design for you, and breathing techniques, and owning an oximeter to measure the oxygenation is a very important thing. so that you can then report to your doctor. If it goes down below 98, 97, you should report it. Next, please. Okay, stress and the dopamine connection. Well, I think, can you please go back? Right, just stay here, please. Okay, stress and the dopamine connection. I think we can all resonate with that, folks, that most people will recognize that if you are stressed in any way, be it exhaustion or emotion or mental, any kind of form of stress or symptoms can be exacerbated and are not helped by any medication, because the pathway, the metabolic pathway for producing adrenaline for stress is compromised by stress. Okay, next please. Thanks, Vicky. So under stress, adrenaline is produced by our cells in order to cope with stress. This is natural. But how does the body do this in all of us? Again, the magical enzymes activated by specific coenzymes produce adrenaline. And guess what? It's from dopamine. So dopamine is very important, not only for the control of movement. This neurotransmitter also is used. Once it's become dopamine, it can transform to adrenaline. So next one, please. Now, what are some of the specific coenzymes that transform dopamine to adrenaline so that one can have an adequate response to stress? Vitamin C is an important aspect for the adrenal glands, copper and methionine from an amino acid that's from protein, part of a molecule from protein called methionine. There's also a very special metabolic pathway called methylation, which is for the medical and nutritional fraternities to test in all patients. And this methylation is also involved in the making of adrenaline, and it uses the coenzymes vitamin B12, vitamin B6 in special forms, methylated forms, and folate. Next, please. Now, I had said before, cells cannot produce an efficient adrenal anti-stress management system in Parkinson's. Next, please. Oh, we've gotten lost, Vicky. Can you go back? I think we're still on stress. Go to the next one. Right, go back one. Because we're on stress, we haven't finished the stress ones. No. Right, there's a whole thing on stress here, Vicky. Go slowly now, forward one, okay, forward next, forward next, forward next, forward next. Okay, important to know that I'm talking today in this lecture about dopamine production from dietary protein and down to adrenaline. However, dopamine does metabolize further to other aspects in the body, but we are only talking as far as dopamine to adrenaline. And certainly in my publications and those of others, you can see where else dopamine goes. But the most important for functional health is what we are talking about today. Next slide, please. Now, it's important to keep blood sugar regulated for stress. This is very important. And again, somebody who's giving you dietary advice will advise you on the diet, how to keep your blood sugar levels balanced. And this helps with mood control, which of course is important from stress control. And eating appropriate food regularly is essential. Remember every 4 hours also that the brain has used up the glucose, the fuel from before. So from the point of view of a stressor on the body, important to have diet well regulated. Next, please. Okay. Nutritional supplements and diet will be advised by and based on laboratory testing. Next, please. Okay, go back one, please. Sparing dopamine. Okay, if you can stay there, please. Now, as we know, the symptoms are exacerbated when people are stressed, not always alleviated by increasing the drug regime. So we have to have another way of controlling stress. And fortunately, we do have those abilities for mind control and general lifestyle control, which will lower the stressors. And that will only be helpful in keeping as controlled as possible the Parkinson's symptoms. Next one, please, Vicky. So what we have is stress relief techniques, absolutely essential. And certainly in our clinic, everybody is advised as soon as they come for an integrated management that the stress relief, and the support, psychological support is essential, because everything else is then affected, positively or negatively according to the stressors. Next, please. I'd like to recommend very much this wonderful CD, which has been designed and presented by a psychotherapist and a very wonderfully registered hypnotherapist, David Urey, who's been used to working with Parkinson's disease. He's brought out a CD, Parkinson's disease relaxation. We certainly do recommend it, and it gives the most wonderful stress management techniques for people and their partners with Parkinson's and their partners to use when they go to sleep. Wonderful feedback on techniques for sleep, and then they can be played. It can be played during the day, and then the voice of David Urey is music. And when he says just the word relaxation in this musical tone, you can carry that through with you. And when you're very stressed, you can go forward. However, not when you're driving, okay, or having to administer anything physical, because you will be so distressed. But it's vital for stressors to be controlled. We also recommend autogenic training, which is very helpful. Please go back. Psychological and psychiatric support. I don't know what's happening. Can we please go back, Vicky? Please stay on this. Can we stay on this one, please? No, we've moved again. Just please remain. Vicky, can you please go back to my previous slide? Okay, please stay. No, why is it moving? Okay. Autogenic training, psychological and psychiatric support, meditation, mindfulness people find very helpful. Qigong breathing exercises, absolutely wonderful. Tai Chi for helping with the balance. Specialized diet and supplements according to biochemical individuality for stress control. Next slide, please. Okay, now subjects to consider when we're first given the diagnosis of Parkinson's, what are you going to do? What will really help with stress management and coping with the Parkinson is to ensure the following specialisms are put in place and requested by your GP for you, which will help stress all round. A neurologist and other medical specialists. It could be you need a gastroenterologist, a skin specialist, etc. A Parkinson's nurse. Psychotherapy, absolutely. Psychological support for people and partners. Specialized stress management techniques, such as autogenic training and hypnotherapy. nutritional therapy with biochemical analyses, remedial movement, physiotherapy, breathing, osteopathic assessments, temporomandibular joint here, very often neglected, should be checked by your dentist or your physio or your osteopath, because if there is something not in alignment with the temporomandibular joint here, it can affect symptoms as well. And speech therapy, important, music and dance therapies. All these kind of things in place will be helpful in the management of stress and the management of the way forward. Next, please. Okay, a very important thing, promoting regular bowel function. Next, please. Research recognizes the intestinal tract as the second brain. We now know there is the gut-brain axis, and 75% approximately of our whole immune system lives in the gut. It's known as the microbiome, and its function and contents are nutritionally influenced, as well as stress and other aspects. Now, what's important is keeping the membrane lining in good condition. Can we go back, please? Is very, if we could just stay put till I say next, thanks so much. It's very important that we feed the membrane of the gut. That is specialized, very important, because it's the same kind of membrane that protects the brain. And in Parkinson's, this is vital. A judicious diet, support of pharmaceutical and surgical effects on the microbiome needs support. We need to support the microbiome, the digestive enzymes, ensuring optimum daily function of bowel, excellent function of bowel movement. And we must have assessed whether we're carrying any parasites there or other infections unbeknown to us in the gut, because if they're there, it's a stressor and it's going to affect symptoms. Next, please. Now, it is so vital to have an adequate clearing by not being constipated of the bowel every day, because otherwise you will have food undigested sitting over the absorption sites for your nutrients and for any medication you might be on. So this is absolutely vital, clearing the bowel well daily. Next, please. Okay, we need to take time. If we are constipated, we need to take time. Visit the toilet a little while after each meal to establish a regular pattern, a gastrocolic pattern, a lot of people lose the rhythm because they're so constipated, they don't try anymore. So try and establish to go to the toilet regularly, maybe 10 minutes after each meal. Doesn't matter if nothing happens, just give it a chance for the food to move. And maybe in a few weeks, you will get that message, move on. Abdominal massage, specialized in exercise, sufficient fluid, adequate fiber, which is appropriate to Parkinson's, fruit and vegetables, soaked prunes, soaked in water to be rehydrated, or figs spread over the day, not in just large batches at your breakfast, just a couple over the day spread. We've said fiber, natural, safe nutritional supplements, but not the regular use of harsh laxatives, because in the end that causes what we call a melanosis in the gut and also takes away its own ability to move. And no heavy protein at night. Keep the protein for during the day when our digestive enzymes for protein are optimal. Next, please. If constipation, diarrhea, or bowel incontinence remain problems despite people having had a colonoscopy and proper assessment by a gastroenterologist, ask the GP for a referral to a neurogastroenterology unit. This is a specialism. One can't just mess on forever. Please go, yeah. What's happening? Can you please go back to where we were? Okay, stop here, please. Okay. If, despite diagnostic investigation by a gastroenterologist, the reason for your diarrhea, your constipation, and your bowel incontinence remains a problem, ask for referral to a neurogastroenterology unit. This I find is not often done. And it's a marvelous, marvelous help for chronic constipation and the other bowel issues. And in London, one of the pioneers is a Dr. Mark Scott in London, is a neurogastroenterologist. Can you continue? Thank you, Vicky. Okay. Nutrition tips for taking, now I think we didn't talk, yeah, nutrition tips for taking drugs more effectively. This is a very important subject, which we need to do, tutorials on, but now I am just mentioning it to you. There is the way what we eat, which food molecules we're able to digest well, will affect the response to the dopaminergic drugs. Can you go on, please, Vicky? Right. Now, protein digests down into amino acids, and a group of them called the neutral ones are produced from dietary protein. But when they reach a certain point in your small intestine, they compete for the protein carrier of your L-DOPA through the intestinal wall and through the blood-brain barrier. This is the L-DOPA in your medication. And there are very specialized monitoring schemes for drug and nutrient interactions, what will compete with each other, and their responses. And these schemes enable the correct personalized timing. Each one of the people with Parkinson's really needs a different time to take their drug and a different dosage. And this will, when it's so personalized for you, by following these very specialized monitoring schemes, and you'll see I've got a reference slide with where you can find them, will help to reduce your dyskinesia, because you won't have any drug-induced too large amounts which are contributing to it. So you can reduce it, and it will avoid the off period that we have shown that one can avoid the off period with the judicious and properly supervised monitoring schemes. But this is important to know, that dietary protein competes for the L-DOPA carrier, but it can be well sorted, as well as sorting out dosages to each person, timing, and avoiding the off period. Next, please. Okay. Go on. Thank you. Now, there can be side effects such as nausea from your medication. So unless otherwise prescribed, to avoid or reduce the side effect of nausea, take your medication after meals. This is different to L-DOPA, which when you will, look at the special recommendations for timing of taking L-DOPA relative to your food, L-DOPA will be best taken on an empty stomach, but all the other dopaminergic medications can be taken after. So if nausea is a problem, it will really help. But always, if your drugs cause any discomfort, don't wait for your next appointment. Contact your GP to arrange a drug review by your neurologist, because that's the idea, that you should be helped rather than that you are suffering. Next, please. Antibiotic therapy, we need to help with a probiotic support of probiotics, and one of them called Saccharomyces boulardii. Whenever one takes an antibiotic, these can be obtained from a pharmacist and from through your GP. Probiotics and Saccharomyces boulardii will prevent any antibiotic induced diarrhea. Okay. However, just to go back to that before I go on, you cannot take those probiotics at the same time as you take your antibiotics, or the antibiotic will eat it up. So wait 2 hours after you've taken an antibiotic to take support during your day of a probiotic. That's very important, 2 hours away, so they don't compete with each other. Now, safety and hygiene in the kitchen is so important, because it's all very well saying we need a good diet. We've got to be safe in our kitchen. Next, please. Can you go back once? We need a good fire control. Oh no, fire control. We must be able to wash our hands well and rinse after soap well. The holding temperatures are very important, that if food is delivered to you, it doesn't after an hour and a quarter grow bacteria, which does happen if you leave food to cool off. Also, the fridge must be 5 degrees or lower to keep food without growing bacteria. I'm talking about centigrade now. Specialized utensils and aids to eat if it's difficult. You need an occupational therapist. It's all very well having the diet if you can't manage it well or chew it well. Cooking methods are important. It's important to perhaps have food delivery or pre-prepared food if you can't prepare it all yourself easily and safely. And microwaves are only really of use for safety, if you're unsafe with a tremor or stiffness or freezing, manipulating hot utensils or boiling water, and only then a microwave would be suitable. But remember to stay 60 centimeters away from it, because then you won't get the radiation. This is absolutely vital. And don't microwave in plastic, in glass, do in glass. Next one, please. Okay, healthy eating tips go on. Thank you. Right, for most people, what seems to suit them in Parkinson's is a gluten-free diet and a dairy-free diet. There are other substitutes, gluten substitutes, rice, millet, buckwheat, dairy. You can have rice milk, coconut milk, nut milks, because it has been found in research that certain molecules in these foods act as what we call molecular mimics and affect our autoimmunity. So therefore, you know, why not give it a try? But again, never without professional guidance. And I will say something after changes as well. Next one, please. Less red meat, because Parkinson's is an inflammatory illness in the cells, and red meat produces inflammatory cytokines, hormones, leukotrienes in the gut. Also, it takes longer to digest. So those who have got constipation, you know, it's better to have it reduced, and unless your doctor tells you otherwise, and have it midday rather than at night. Alcohol is a problem for Parkinson because it needs detoxification, and the liver does not detoxify well in Parkinson's. There is a problem in phase 1. And now, if you've got a high blood pressure, you've got to look out for caffeine, but otherwise, you know, reasonable, depends on, you know, what your health situation is. Next, please. Okay, the diet should regulate, have anti-inflammatory foods. Which I said it's an inflammatory cellular condition, but oily fish is very important. It produces a hormone called omega-3, and it will help the cells produce those anti-inflammatory hormones. Don't cook higher than 160 degrees, because once you heat food higher than that, particularly the fats turn into trans fats, which are not healthy. And use organic cold pressed olive oil for your cooking, rather than any polyunsaturated oils, which if you use them and you heat them, they become trans fats. Next, please. Okay, we've said don't heat the oils, and antioxidants are very important because many foods are oxidized. They produce unwanted amount of free radicals in our cell membranes in Parkinson's. We need free radicals, but not the amount that are produced in Parkinson's. And so antioxidant foods, which produce antioxidants, act against pro-oxidant events, and they are found in rainbow colored vegetables. All the different colors give you the different nutrients which act as antioxidants. Next, please. Okay, now this is a very, very key message. It is essential that any dietary change takes place very gradually. This is vital in Parkinson's because detoxification is an absolute problem. And if the fat cells start releasing toxins from foods that have been locked up in there and perhaps not the best thing for you in Parkinson's, the liver will not cope. So, and one can be really ill. So if you're going to change anything, and again, only under supervision, only change one thing in your diet every 2 weeks, not under 2 weeks. And if one is a person who relies a lot on alcohol in the diet, it must take many weeks, many weeks. We always say a half a glass and replace it less per week and replace it with something else delicious. But that has to take many, many weeks under supervision. Otherwise, it's very dangerous to change things in Parkinson's. Okay, next one, please. Okay, detoxification problems with the liver in Parkinson's. So it's best to avoid detox programs and just keep to a healthy diet with no alcohol, as it requires efficient detoxification. Now, if you're taking L-Dopa and certain drugs, very important from a detoxification point of view, not to take grapefruit or grapefruit juice, because it's got something in it called naringenin, and it's deleterious if you are taking that drug. Very, very important, naringenin, to be considered by your health professional in whatever program you are taking. But do remember about the detox programs, because many people say, oh, I want to do a detox program. I'm going to a spa, and you can land up quite ill, because it's just clean up the diet. Your health professional will give you the nutrients which are necessary for the liver to do its detoxification metabolism, and stay with that, but nothing dynamic. Next one, please. Go, next one. Solution to swallowing problems. You must immediately be referred to a speech therapist with an ENT specialist who will judge what that problem is. Is it safe to feed this consistency or that? Do you need specialized feeding, specialized exercises? It's very dangerous. And we can talk about good diet. If you can't swallow safely, that is life-threatening, and also you won't eat as much to keep yourself as healthy as possible. We like to say speech therapy earlier rather than later in the diagnosis of Parkinson's. We like that right at the beginning. You know, it's like being an athlete. You keep your muscles in good condition. Swallowing problems we've spoken about. It can also be that one needs specialized feeding of pre-digested foods as well, and that is again going to be suggested by a dietitian together with a speech therapist and an ENT surgeon if there are a danger with swallowing. Next slide. Dealing with weight problems, weight needs to be constantly monitored, because one can be either losing or gaining and nonetheless having a good diet, because there could be maybe a reason for it from another illness, something with the thyroid, or heaven forbid, some malignancy. So immediately you see something with your weight fluctuation, it must be immediately flagged up to your GP for investigation. Next, please. right? We've said maybe there are reasons for weight loss, not enough food, you can't swallow and chew easily. Oh, I forgot to say also, the dentist is very important for seeing whether your mouth is in good condition for the chewing and so forth, and whether if you've got dentures that they're well fitting for chewing. This is very, very important, and the mouth hygiene is terribly important as well. So we're talking about nutrition, it uses the mouth. Okay, next, please. Okay, speech and voice projection. We like to recommend that also right at the beginning, if it's possible. Ask the GP for referral for speech therapy to keep the voice resilient and to keep the exercises going for it, not to wait for a problem. In the book, Parkinson's Disease, The Way Forward, we have a chapter there by a speech therapist who says that she likes to have referrals before there's a problem rather than after. Next, please. Thank you. Speech problems, we've done that. Okay. Next, please, Vicky. Sleep. Some of us are concerned with sleep, so let's go on to one or two tips there, which are related to nutrition. The blood sugar should be regulated, not to go to sleep hungry, certainly 4 hours after supper and you haven't eaten anything. So eat or drink a small snack before retiring. In case you are on also on L-Dopa, some applesauce or vegetable soup won't interfere and compete for its absorption of the L-Dopa, and it's very easy to digest and won't keep you up. So a little something before you go to sleep, and very important, the room should be dark to support the production of melatonin. That is a hormone produced in order to fall asleep. But if there's even a chink of light from your phone or from under the door from the hallway, make sure that that is out. Also, don't be watching your television screen and your mobile phone, after, hours after darkness at night. And if you do, you must acquire you can acquire some special glasses which negate the effects of the blue light, it's called. And do ask your optician to guide you with that. But it's very important and will help sleep. And make sure also, just by the way, that you're comfortable in bed and can turn over easily. You need the occupational therapist perhaps for that. And we do find that saying silk sheets and silk pajamas, you slide more easily, but the occupational therapist can help because that can affect sleep as well. Next. Helpful CD, again for sleep technique. We do recommend again Parkinson's Disease Relaxation by David Urey. It really is really wonderful for bringing one down to a very deep mind-body relaxation, which one requires in Parkinson's and does help one to sleep, including one's partners. Next. Oh, it's just a reminder of it again, and how important it is to have the stress reduced, which this absolutely does. Next one, please. Now, tests to discuss with your doctor. Okay, next one, please. It would be appropriate. Yes, that was a good one. Thank you, Vicky. You're a very good engineer there. Thank you very much. It would be appropriate to ask your doctor to organize tests to evaluate your nutritional status, pertinent particularly to the metabolic pathways in dopamine, adrenal, and thyroid metabolism, in addition to the routine medical tests. This is all very, very important. Another thing I'd like to also say, which is just not on the slide, but I'm adding it to it, it's very important to regularly have your skin monitored. This can be very important to look out for any dark lesions and change of marks on the skin, both because of Parkinson's, but also if you're taking L-Dopa. And so part of tests to discuss with your doctor, it's monitoring of your skin, plus the routine medical tests and the nutritional status ones, all of which are available to be had and to help in the recommendations for nutritional management and other medical needs to you. Next, please. Okay, now interesting just for your note that since 1996, with hundreds of nutritional and as well as routine medical tests that we have done, 100% of those patients have Parkinson's patients have demonstrated one or other cellular deficiency in an aspect which played a role in dopamine metabolism. And therefore nutritional status is very important to be able to have that assessed so that one doesn't have to have the body contend with the deficiency becoming less and less and less. Okay, next one. Partners and caregivers. Next slide, please, Vicky. The partners or caregivers of people with Parkinson's, you are very important and of course loving people. You are vital team members. If indicated, yourself acquire stress management techniques as may be offered by autogenic training, meditation, mindfulness, and hypnotherapy, and the CD by hypnotherapist and registered psychotherapist David Urey, similar to that. And so that you yourself do not become overwhelmed and stressed from the concern and responsibility that you feel that you have a need to express. This is very important because when you are caring for someone and you live with someone, you take it to heart. Therefore, get yourself sorted out so that you can be centered and strong and keep yourself in a stable position, exactly the same as the person who has had the diagnosis. You are the same people as before your diagnosis. Remember that, you and your partners. And most important, take time for your own interests and arrange respite care if needed. If there are some people that are needing, 24-hour, care and vigilance with them, make sure that you do take a break, and there will always be respite care available. And I know that Parkinson's Care and Support looks at all these aspects as well. Next slide, please. Right, the next part of this presentation is just all the references to the topics we have mentioned tonight. So could you just go slowly, Vicky, through the first one? And then I'll tell you to change. Yeah, this was, no, can you go back again, please? Nutrition as applied biochemistry. You can see where you can find that. It's in our book, Parkinson's Disease, Dopamine Metabolism Applied Biochemistry and Nutrition, which Dr. Jeffrey Leader, myself, and Dr. Nicholas Miller have done. Next one. Next slide. Thank you. Dopamine metabolism. Oh, we need to go back, please. Go very slowly, please. Yeah, thanks so much. The dopamine metabolism reference, you will find this in this excellent Harper's Illustrated Biochemistry. Next one, please, Vicky. Mitochondrial references, that's the cell energy references, are all there. Harper's Illustrated Biochemistry, Brallian Law, the laboratory evaluations, and Principles of Biochemistry by Leninger et al., and Vote and Vote Biochemistry. Next one, please. Adrenal stress references are there. Again, the Harper's Illustrated Biochemistry. Next one, please. Dietary protein L-DOPA references, here they are. You can find those very special monitoring schemes. They are the only ones available, as if I had to put them there. And we have presented them internationally, and they are accepted. And you can see those books. There's the original work done to identify those competitive amino acids were done by Kempster and Wahlquist, and they presented it in Nutrition Reviews. And then Dr. Jeffrey Leader, myself, Professor Leslie Findlay, we presented all the schemes for all the drugs in Parkinson's disease, reducing symptoms. And again, how to optimize on-off periods is again the reference for how to avoid the off period. And they've got all they've got the scientific references in, which is absolutely vital for you to know that there's nothing in tonight's presentation which does not have a biochemical peer-reviewed reference in it. Next slide, please. Inflammation references, inflammatory processes in Parkinson's disease from the Annals of Neurology, and again, another neurological exposition on oxidative stress and inflammation. So at the, I'll say something at the end. Next one, Vicky, please. Again, free radicals. Again, this was a very excellent chapter by Dr. Nicholas Miller in Parkinson's disease, dopamine metabolism, applied biochemistry and nutrition. Next, please. Detoxification, you've got the references again, textbook of functional medicine, Jones DS, and then again, DNA methylation in Parkinson's in neurochemistry. Next one. Free radical reference, that was going back again. Next, Vicky. Next, Vicky, we've done those. Next, next, next. Okay, then I am ending there with the bibliography, which I used for my talk, which is based on our work and collaboration with other authors. And what I want to say is, as regards the references or bibliography, you can, this lecture is going to be available through Parkinson's Care and Support for 1 week. So you will have a chance, if you do want to go back and seek out the references where they are yourself, you will be able to get them from Parkinson's Care and Support. Next slide, please. Now, I want to make special acknowledgement and thanks to my clinic director, Dr. Jeffrey Leader, who has been the inspiration all these years for integrative care. He himself is a medical specialist who has also got his training in nutrition therapy and is a consultant himself, has been a consultant in pain management, consultant in intensive care, specializing very much, his very special interest in Parkinson's disease as used to monitoring drugs, and as a consultant anesthetist, head of various clinics, as well as the integrated chronic care clinics. I also wish to thank Dr. Serena Leader with her editing facilities as well, and she has played a role very much so in the work of collaboration of GPs with nutritional therapists. Thank you, my team, and thank you so much to Vicky for saving tonight and acting as a wonderful engineer, and thanks to all our audience there for your patience tonight. We don't know what must have happened. Was it COVIDitis of the cyber facility? Because I can assure you that Parkinson's Care and myself have worked very hard to make this, be a perfect screen presentation. We open the floor now for questions.
Thank you so much, Lucille. That was, I've never met anyone in my life that knows.
You're muted.
Oh, hang on. You should be able to hear me now. Let me just check.
Muted.
Okay. So Alan, can you hear me?
You're not muted, we can hear you.
You're not muted, Vicky.
I cannot hear anything, Vicky.
Okay, so maybe on your side. I'm not sure why you can't hear, Lucille.
I still
Everyone,
cannot hear. I'm not sure how you're going to organize this
yeah, okay.
question and answer.
Just bear with me, everyone. So everyone can hear me, but they can't, Lucille can't hear anything. Just get my technical whiz kid in. Hang on. Bear with. She can't hear anything. Audio setting.
Press share screen.
Or shall I switch on my phone?
No, press share screen at the bottom. And now stop.
Oh, no, can't.
No,
Oh,
just cross it down.
I don't know what to do. Well, you made me press it.
Yeah, cross it down.
Two seconds, guys.
Can you hear me? Can we hear you? Can you?
Yeah.
Oh, now I can hear you.
Oh, you can hear me?
Yes, I don't know what's
Fantastic.
happened to the speaker.
Okay, fantastic. Do you know what? I think we've got a little Parkinson's ghost here tonight, because with that changing screens thing, I'd press it once, then it would go on too.
Oh, there was a little elf there. There's no.
Yeah, there was a little Parkinson's
little-
elf, but
was it-
nonetheless, it didn't detract, Lucille,
Oh, I'm so pleased.
from
I'm
your
so pleased.
from your wonderful presentation. Do you know what? Can I just kick off with one question before being greedy and selfish? But I just wanted to ask that whether you could tell everyone here a bit more about any group tutorials you and Jeffrey offer.
Oh, okay. If people are interested in knowing more about nutrition and it more personalized to themselves, then we do. People are not having to be patients of our clinic at all. We do independently clinic tutorials. We call them clinic tutorials because they're based on work, in which then we give everybody 9 pages of questions. So who wants to join an educational tutorial, and we can see what their particular needs are. We invite them with their themselves with their most important supporter, and we work over 5 to 6 hours on different days, different mornings, and we go through all the aspects that people can get on with safely prior to actually going to have a one-to-one appointment with a therapist. There are aspects that one can address safely and directions that one can point to, and the feedback is fantastic because people wait, to get to various clinics to see this person or that person for their health. But in the meantime, from a nutritional point of view, there are things that they can get on with safely. And we do this over 5 or 6 hours, but we do make it very personalized, so much so that we take 9 pages from everybody first so that we know what we're dealing with, who we're dealing with. There are question and answer as well. We do not tell anybody what anybody else has got, but all that is dealt with in addition to our program. If you're interested, I can send you the subjects, or it's on my website actually, lucilleleader.com. You can actually see what subjects are addressed safely, and we could do something together. Okay, we never do, we have it's a small group at a time, so that we can address everything. So, that's very important to know. And it's together with the supporter, no person is on their own.
Fantastic, thank you very much. Right, let's open it up. Let's get some questions for Lucille. So who would like to ask? Anyone? I'm just looking now, I'm gonna go back. Oh, so Smita, would you like to say something? I'm going to just ask to unmute you. There you go.
Yeah. Yes, I'd like to know what Lucille would think about sun chlorella and spirulina in some case, because they are rich in protein and spirulina basically, and sun chlorella, it has lots of minerals and vitamins that can help to increase energy as well.
Well, yeah, again, it's individualized. It's individualized. Okay, that's what I want to say. If you feel as a therapist that it is pertinent that they have that food, that's fine. Remember, though, that chlorella is a binder also for anything that's the liver and you know, the bile is giving off. Just make sure everything goes very, very slowly, because you don't want to be pulling things out too quickly. Okay.
Fantastic. Thank you for that. Okay, Alam, I'm gonna let's unmute you. The floor, there we go. The floor is yours.
Lucille, thank you, Vicky.
Sound is stopped.
Oh, you've frozen, Alam.
Her sound is frozen.
Yeah. Okay, I'll tell you what, Alam, we'll come back to you.
Lucille, I was wondering what the relevance was for monitoring the skin. I didn't know. Okay.
Oh, the relevance for monitoring the skin. Melanoma. It's there is the pathway from dietary protein goes to tyrosine, goes to L-DOPA, goes down to melanins, and there is the research that shows there is an inclination in a peculiar metabolism, just as L-DOPA has a peculiar metabolism from to dopamine and other, and also from I have published that down to the protein, down to the down to tyrosine and the thyroid. So that's, but we know we have to be very careful and keep monitoring, and especially if you look at the drug recommendations of the manufacturers of L-DOPA, they will also say, you know, it's a consideration. That's the relevance.
Thank you, Lucille. Is there anyone else? Sarah?
Sorry, Vicky, I got disconnected. Did we get a
response?
response?
Make you put on weight. I see that one.
Sorry.
Melanoma was yeah.
Now I must say something. Don't all think you're getting melanoma. It's not everybody's thingy, but it's something that one has to. If you're looking at people's general health, you're going to look at everything. You're going to look at the skin. The skin even has got a biome in it. So, you know, it's very important, a microbiome in it. You have to look at all aspects, but you must know about this as well. And virtually nobody gets it, but you have to be aware of changes on the skin, right?
Thank you so much.
Thank you. Right. Let's just.
Oh, here's a nice one.
Okay, hang on. Can you wave your hands? It's just there's so many. Oh, okay. Audrey. Hang on. We're just no, she wasn't waving. Andrew Mann. Yeah. Okay, great. I can't.
Hi.
Oh, we can hear you. We can hear you. Go for it.
Okay, I was muted. Sorry. I had a question about the connection between taking rasagiline or Azilect and tyramine, H cheeses, beer, all of that.
Yeah. Okay.
Thank you.
Yeah. Okay. Yeah. Firstly, there is, of course, monoamine oxidase drugs you're mentioning with those aged foods, right? Those foods which are aged, like the aged cheese and the whatever. Yeah, at a certain level, they are contraindicated because they do cause certain syndrome and are completely contraindicated. But in Parkinson's disease, if one is only taking the rasagiline, usually the dose of rasagiline doesn't go above 10 milligrams, and that then is safe for those foods that you mentioned. But anything higher in any monoamine oxidase drug, be it monoamine oxidase A or B, if it goes above 10 milligrams, you can get all sorts of health problems. Okay.
Thank you, Lucille. Okay, anyone else as I scroll along? Okay. Oh, hang on. Biochemical. There's something in the note in the chat. Lots of those. Are there any questions in there? Just seeing. Do you do a full blood test, heavy metals, etc. at your clinic? If not, can you recommend where one can be done, please? Thank you.
Right, you need to have a therapist or a doctor authorize this from the appropriate laboratories, there are different ones for different aspects that need looking at. Biolab Medical Unit is the one that pioneered the nutritional status, but they also take bloods for other labs in town, which they will send for the thyroid or for this or for the parasites or whatever. But various ones, the doctor's laboratory, the London clinic, so on and so forth. But where to start is that someone needs to look at your health history, your clinical history, to know which tests to give for you, which are appropriate to you. There will be, yes, one can say, yes, all the vitamins and the minerals and the essential fatty acids, that would be a routine one, a full blood count, a thyroid, a ferritin, looking at certain, we know in Parkinson's now we're finding lots of stealth viruses, not the COVID, stealth viruses and bacteria, and we send those to Germany. But other clinicians who will be trained in that way will know how to help you. But just to go and present yourself at a medical laboratory, one wouldn't know what to start with you. You'd have to know. Perhaps if you came to a tutorial, you'd get a little bit of a pointer of what to speak to your GP about. But you know, otherwise, you know, I need to tell you who's been trained in this way and will help you. Okay, it's very important. I'm pleased you asked the question, but you can't just do it on your own because you don't know where to start. There are many aspects, and it's fascinating and very helpful.
It's so interesting, isn't it? I mean, the thing I'm taking from this, and I think we've all learned this, is that Parkinson's is such an individual disease.
Yes.
So, I mean, you know, we can all be told, oh, this supplement will be good, or that supplement will be good, but actually,
different for everyone.
Yourself. Yeah.
Yes, everyone is different. And if you just go and pump yourself full of a particular nutrient because you think it helps, the body will do the wrong thing with it if it doesn't need it. It's so now this is a very much a science, but it's so lovely that we've got the knowledge to be able to give the right recommendations.
So it's worth its weight in gold, really, to
yes, to have some tests and to have the right trained people to tell you. Yeah, it's individualized medicine. You know, there's a degree now. I'm actually one of the lecturers. One of the universities has a degree in called personalized nutrition. It's all applied biochemistry, and I do on the master's degree for that university, I do Parkinson's disease, just by the way, all the biochemistry, all the tests and everything. So everybody who gets trained on that, they are all postgrads, and you know, they know the way forward. That's my class. Okay. But it's individualized, it's personalized medicine. It's called personalized degree, degree. There we go.
Okay, let's take it back to the floor and just check before.
Audrey Boyle, I know Audrey Boyle. Hello.
Audrey. Where's Audrey gone? There she is. Would you like to ask anything, Audrey?
Hello, everybody.
Hello.
Yeah, I was just wondering for Lucille, is there a list of functional medicine practitioners that people can go to or look out that might be near them?
I'm not sure. I think you need to contact the Functional Medicine Association, but I can find out for you. Okay. I mean, I of course practice functional medicine, but there is an association now which has been set up by Dr. Jeffrey Bland from the States of functional medicine training, separate training here, and I'll get this. But Audrey, I thought you knew one. Excuse me saying.
Sorry?
I thought you knew a functional medicine doctor, no?
Well, I'm seeing one, but I just was thinking from the point of view of everybody else, whether, you know, there might be some doctors, functional medicine doctors near people's place where they live.
Well, we could find out. I could find out, and I'll give Vicky, you know, a contact there which she can give to people for the Functional Medicine Association.
Yeah, that'd be great, because they are then in the position to do these tests that you specify.
Yes, absolutely.
Yeah.
Yeah.
Yeah,
Thank
fantastic. I can follow up with an email with some recommendations and more information on it. Okay, I'm just looking at everyone's faces. Are there any more? Wave your hands in the air if you've got. I mean, the thing I'm taking out from this as well are really positives. You know, there are so many things that, oh, we've Debbie, I've just seen that hand. Right, here we go. Ask to unmute. So you just need, there we go. Over to you, Debbie.
Oh, hi, thank you for the presentation. It's been really good. My memory's terrible. So I'd be really interested in the nutritional information, taking part in that. Did you say there would be a link to follow? Will it afterwards?
Oh, you mean do you mean the tutorial, or you mean which do you mean link to?
I mean, well, not so necessarily a link. You know, you said about the 9 pages.
Oh yeah, you can just look up lucilleleader.com,
okay.
And it will show there, it will say group tutorial. And then you can send me a message, and then I'll put on the list when we've got just a few little group, we only do it with few, then I can let you know.
Thank you very much.
Okay, you're welcome.
Fantastic. Thanks, Debbie. Okay. Oh, another one. Right. Let's get you unmuted. Hang on. Smita, can you unmute? I'm asking you to.
Okay.
There we go.
Just one question more. Lucille, when you said about the group leader, the group you have for support, is that for practitioner or for people who has Parkinson's disease to be to have some knowledge there, to be trained?
I wasn't hearing very clearly. Did you say the tutorials? Are they for
the tutorial?
No, colleagues can come as well. And I know you are a colleague.
Colleagues, but also it's for people who has
yeah, it's very interesting for colleagues, because then it will help them in their forward way.
Yes, definitely. Yeah. Thank you so much.
Yeah. Okay.
Okay, are there any more questions? Okay, here we go. One more, ask to unmute. Lovely to see you. Thank you. There we go.
Hello, Lucille. Thank you very much for your talk. Very informative. Have you had any success with specific probiotics based on, well, a personal GI 360 or other stool test, or alternatively with the particular probiotics that have been found in the recent research to be connected with Parkinson's in
there's some proof, yes. No, it's look, nobody really knows what receptor sites we've got for which of the strains in the gut. So really one is advised to keep changing strains, because you don't really know which receptor sites are there to receive which. Okay, so in the courses that I've done, I've always been recommended, or the speakers and trainers have been recommended, just to keep changing strains as well. So not to sit on the same thing. So what we do is we let them finish one set of things, and then then a break, because there's no research which shows the safety of continuous chronic use of the probiotics. So you need to stop a little bit and then start again. Of course, unless someone's with antibiotics, then you do, as I mentioned, you know, and I'm sure you know, the Saccharomyces boulardii is essential to stop the Clos difficile developing diarrhea, and 2 hours away from the antibiotic. But otherwise, just keep chopping and changing. Don't stick to the same thing. And of course, choose companies which you know have made some clinical presentations of their work, some research. You know, don't just you know, take this collection of stuff or that. You need to really make contact with them, with their technical service, and say, please give me a report, please, of your own clinical findings. And you'll be surprised how very few ever come back to you. You've got to be really very, very judicious on all nutritional supplements. There's a lot of stuff out there with titanium dioxide, silicon dioxide, and all that sort of stuff that's going into all sorts of stuff that people put into their mouths for so-called health purposes. We have to be very, very judicious.
Yeah, absolutely. Thanks.
Okay. I think you're a clinician yourself.
I'm in 3rd year at ION.
Oh, you are. That's very interesting. My alma mater, right?
Yeah.
Oh, hang on. Sorry, go ahead.
Sorry, I just thought I'd follow on from that. Just wondering if you've had any success with oral probiotic use.
Well, I'm talking oral probiotic.
I mean oral cavity focused rather than GI focused.
Oh, oral cavity. No, I haven't, but I would imagine that it's just as pertinent, because in all the skin and all the mucosa, we have got those same microbiome receptor sites, and them sitting there. Most definitely is absolutely vital. Yeah.
Yeah. Cool. Thanks.
Yeah.
Thank you for that. That was really interesting. Sarah, you're scratching your head rather than asking. I think, yes. Okay. Right, should we do 2 more questions and then finish up? Alam. Okay.
Lucille, just another question, if that's okay. Something I have been doing over the last 4 years, because I don't take medication and I've been taking an integrated approach. One of the other things, and all the things you've mentioned, I've been trying to work on mostly. And one of the things I've done is trying to reduce the chemical load. So I'm very anxious about chemicals and personal products, chemicals we use for cleaning products, etc. Well, what's your view on that?
Oh, definitely. Definitely, it's very important to lower the chemical load in whatever we can use, which doesn't have a dangerous chemical in it, is very important, including our cooking utensils. We shouldn't have aluminium in them and so forth. You know, whatever you're using, be it your cleaning materials, indeed, that's very important. I just wanted to say something, though, that you were saying you don't take any drugs, you take an integrated approach. An integrated approach means everything that is available. It's not just the non-pharmaceutical. Integrated means whatever is necessary for that patient, because some people can do it without drugs and some can and some can't. So I just wanted to make that clear, that when I have associated myself with integrated nutrition, it's with everything integrated, not just taking a part, because then again, it's not integrated.
Yeah.
Okay.
Thank you.
Good luck with what you're doing. I think it's marvelous.
Thank you.
To be doing well. No, it's very important to leave out the chemicals, but again, don't change in terms of chemicals and food. Like I said before,
gradual.
Okay.
Everything's
very
been
dangerous.
Gradual.
Very dangerous. Yeah.
Yeah, very gradual. Everything's been gradual over the 4 years. Very gradual. Thank you.
Fantastic. Thank you for that. Right. Any more? Okay. Shall we wrap it up there? That has been so enlightening and so interesting. Thank you so much, Lucille. Really great. And you know, I think it's really useful that you also have lots of books and publications available, so we can actually go and buy and take our time and read things. I mean, this for me has been, you can't, I'll go like that, but this Top Tips book has been really good for me to just go through slowly, to go through everything that you've been saying tonight. Would you like to end and say a few words to end?
Right, well, thank you, and I'm pleased you found Top Tips. It's a very good introduction, and going on to like reducing symptoms with nutrition and drugs, and the other one, how to optimize. Those are the step forward again, and I'm so pleased you're finding that one a very good introduction for you. Thank you for presenting it. It's very kind of you. Yeah, I would like to say thank you everybody for attending, and you know, if you've got anything special to ask, you'll just have to be in touch with our lovely engineer tonight, Vicky. But otherwise, I hope all your questions were answered. And I wish you good health. Go forward. Fortunately, Parkinson's is a health uncomfortable making illness, but with the right management, with the multidisciplinary approach to whatever is needed, one can be comfortable. One can make that discomfort comfortable, but you've got to make sure that it's integrated. And I know that's what your group, your association here is all about. But and fortunately, it's not a life-threatening thing. It's something you can work on and go forward. And I just want to wish you, together with from Dr. Jeffrey Leader as well, my partner in work, just a good year, positivity and good health. And thank you for attending.
Oh, fantastic. Thank you so much. Can we just do once more, just go through your website? So I will put it in an email, but just so people know where to contact you. It is, I did have it here.
It says all lowercase, lucilleleader.com.
Okay, brilliant. lucilleleader.com. Thank you so much, everyone. Thank you so much, Lucille. I'm so sorry about the technical difficulties with the presentation, but I think you'll agree, despite that, it was fantastic and some really useful information. So I'll follow it all up with an email, and we'll get the presentation loaded onto our website, Parkinson's Care and Support, and that will be available for a week. Okay, and thank you so much for having such an you know, people from all over the world joining us. So happy Christmas to everyone. Have a lovely Christmas, and we will love you and leave you. Okay, thank you. Thanks so much. Bye.
Lovely. Bye. Bye, Lucille. Thank you so much.
Bye.
Thank you very much. Bye-bye.
Bye.
Bye-bye.
Bye, Lucille. Bye.
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 Thank you. Bye.
Bye. Thank you so much.
Thank you. Can I say something?
Yeah, hang on. It's not me and you.
Oh, it's not me and you. No, I know.
I'll tell you.
No, it was for everybody.
Oh, great. Yes, speak.
So whoever's there, I saw a message flash up that said, can I take supplements of vitamin B6?
Ah.
And I wanted to say, don't take any supplements that nobody gives you, and nobody would take one B vitamin by themselves. Can be quite dangerous. You have to take complex, and you have to keep them at a very low level in Parkinson's disease in order to avoid any neuropathies. So I just saw that was flashed up, and I know we have formally ended and I've said goodbye.
No, I think that's good.
That is a very vital point. I saw that flash up.
I think that's
no self-medication of supplements. And 1B, especially B6, they're going to get a big neuropathy from it.
Yeah, that's really important. Just a lovely message at the end. Thank you so much for this session. Well worth the 3:30 a.m. start for me, wherever they are.
Oh my word, I wonder who that was.
So that's
Thank you.
lovely. Nasal probiotics.
Thank you.
I don't have an experience with them yet.
No. All right, I think that's it. Okay, bye-bye, everyone. Bye-bye. So if you all leave, and then I'll stay with Lucille. Hang on, let's see. Okay, let's remove. Move. Okay, everyone's slowly leaving. There we go. Goodbye. Bye. Bye. We've got a few more to go. Just getting rid of them now. All right, 3 more. Here we go. Let's stop the recording.